Assalamu alaikum. This is a lecture titled Immunopotentiation and Immunosuppression. An understanding of the normal regulatory mechanisms of the immune system has yielded an insight into the many ways the immune reaction may be enhanced or inhibited, should the need arise. Clinically, immunopotentiation has been effective in combating infectious diseases, in the treatment of immunodeficiency state, and in the search for a cure for cancer. Immunosuppression has found relevance since the birth of organ transplantation and in the treatment of autoimmunity and allergy. Here we should note some important immunologic phenomena to resolve the conflict and misunderstanding, the hypersensitivity and immunologic tolerance and autoimmunity. What is hypersensitivity? At first glance, it would appear as if all immunity, humoral and serial, was geared toward defending the host against unnatural antigens. Nothing but good should come out of a system so precisely planned to weed out aliens and marauders. However, it is painfully evident that reactions to putative foreign antigens may be excessive, and that if humoral or cellular immunity is switched on to high for any length of time, gross tissue damage can occur. Such reactions have been aptly termed hypersensitivity reactions. There are two categories of adaptive hypersensitivities: immediate hypersensitivity and delayed hypersensitivity. Combs and Gel classified hypersensitivity into four types. Type 1 anaphylaxis, type 2 antibody-dependent cytotoxicity, type 3 immune complex mediated disease, type 4 delayed type or cell-mediated hypersensitivity. Types 1, 2, 3, and 4 are reactions which involve the humoral system of antibodies and are sometimes termed immediate hypersensitivity. Type 4 hypersensitivity involves the lymphocytes and other cellular components and requires a longer time course to manifest. Because of this, type 4 has been termed delayed type or cell-mediated hypersensitivity. Autoimmunity. What is autoimmunity? One of the central concepts of immunology has been that the immune system should be able to distinguish between self and non-self. Immune reactions to self-antigens constitutes what is known as autoimmunity and is injurious to the host. Around 19th century, Paul Ehrlich postulated that the immune system acquires a state of tolerance to self-antigens. In addition, he proposed that breakdown of tolerance would lead to self-destruction, a condition he described as horror autotoxicus. Immunologic tolerance. What is immunologic tolerance? If the normal immune system can respond to virtually any foreign substance, why does it not respond destructively to self-antigens? The absence of harmful immune reactions to antigens is termed tolerance. It has been shown that tolerance can be induced in animals by varying the dosage of the immunogen. Rabbits, which are repeatedly exposed to low doses of weak immunogen, remain tolerant even to a strongly immunogenic form of the same antigen. Similarly, tolerance can be induced even if high doses of the immunogen are administered to animals. Here, this figure shows the high zone and low zone tolerance and the antibody response. In low dose tolerogenic agents, we can see the antibody response is low. Okay. Then, by increasing doses of antigens, it become suboptimal, then optimal, then the antibody response back to the tolerance again in high dose tolerogenic. Hence, there seems to be a low zone and a high zone in terms of antigen dosage for tolerance induction. Experimenters have shown that the T cell is the target for low zone antigen tolerance, and both T cells and B cells are responsive at high antigen dosage. This is an fast introduction to these immunologic phenomena. Okay, how does an individual tolerate self-antigens while generating normal immune reactions to foreign antigens? The answer is to this question is not known. Studies indicate that there are several mechanisms which may contribute to tolerance. Here are clonal deletion, clonal energy, receptor blockage, non-immunologic antigens, anti-idiotypic antibodies, suppressor T cell factors, and other regulatory factors. And we are now back to immunopotentiation and immunosuppression, and let's talk about autoimmunity and immunology, tolerance, and hypersensitivity in separate lectures. An understanding of the normal regulatory mechanisms of the immune system has yielded an insight into the many ways the immune reaction may be enhanced or inhibited should the need arise. Clinically, immunopotentiation has been effective in combining infectious disease and in the treatment of immunodeficiency states and in the search for a cure for cancer. Immunosuppression has found relevance since the birth of organ transplantation and in the treatment of autoimmunity and allergy. Here we can see immunopotentiation. We have vaccination, adjuvants, and certain lymphokines. In immunosuppression, we have cytotoxic agents, we have glucocorticoids, and we have cyclosporine and tacrolimus, and we have anti-lymphocyte antibodies. Remember, this is an introduction to immunopotentiation, okay? Here we have vaccination. Vaccination has been used for over 2 centuries as a means of exploiting the immune system to protect the host against infectious agents. An understanding of antigen specificity and memory has been used to boost the immune response to infectious agents by artificially exposing the host to small amounts of the inactivated infectious agents. Immunization has thus offered protection against a number of potentially lethal infectious diseases such as smallpox, poliomyelitis, pertussis, diphtheria, tetanus, mumps, and rubella, to name just a few. Immunopotentiation, we have also adjuvants. Responses to many killed vaccines need to be enhanced by substances that are collectively known as adjuvants. What is an adjuvant? Adjuvant, by definition, is a substance when incorporated into or injected simultaneously with antigen potentiates the immune response. Here the vaccine alone, and here the vaccine combined with adjuvants. We can see in the first case no immune response. We can see in the second case immune response began to elicit and protection occurs. Mode of action of adjuvants depends on two important factors. On antigen characteristics, some adjuvants affect the way in which antigen is presented, also on host immune response. And we will talk to this in separate lectures. Okay, types of adjuvants. We have primarily 3 types. Organic adjuvants. Organic adjuvants include a variety of organic molecules obtained from bacteria. Muramylidipeptide is a bacterial peptidoglycan. Synthetic adjuvants that increase host immunity include levamisole and isoprenosine. Tufstine is a unique adjuvant that occurs naturally and has been synthesized as well. Immunopotentiation by lymphokines. What is lymphokines? It is the different interleukins and interferons. By recombinant DNA technology, it is now possible to harvest unlimited quantities of interleukin 1, 2, and interferon gamma, interferon beta, and interferon alpha. Interferon alpha was the first to be produced in a large-scale manner. Interferon alpha has proven adjuvant properties as assessed by reduction in tumor size, especially in lymphomas. Interferon alpha appears to act both directly on tumor tissue and by activation of macrophages. Interferon alpha, beta, and gamma are all used therapeutically in a number of clinical conditions. Recombinant interleukin 2 was approved in 1992 for the treatment of metastatic and inoperable renal cell carcinoma. It has been used experimentally for malignant melanoma and HIV infection. It appears to restore both humoral and cellular immunity in nude mice. Interleukin 2 also appears to induce production of interferon alpha by T cells. Both interleukins and the interferons are not free from side effects such as fever, malaise, myalgia, arthralgias, and fluid retention. An alternative approach to the in vivo use of interleukin 2 has been the induction of lymphokine-activated killer cells in vitro by incubation of cells with interleukin 2. Under these conditions, lymphocytes acquire cytotoxicity against a broad range of tumor cells. Cells activated in this manner has been used to cause tumor regression in mice. Clinical trials with these cells in humans have shown promising results. Here we back to immunosuppression. We will see cytotoxic agents, glucocorticoids, and cyclosporine, and tacrolimus, and anti-lymphocyte antibodies. Immunosuppression. Immunosuppression has been particularly useful in patients undergoing organ transplants and in the treatment of graft rejection, autoimmunity, and allergy. Current treatment of graft rejection, autoimmunity, or allergy is not antigen specific. The following are some of the agents used as immunosuppressives. First, cytotoxic agents. Cytotoxic agents such as cyclophosphamide, chlorambucil, azathioprine, and methotrexate block cell replication and preferentially kill dividing cells. Cyclophosphamide and chlorambucil alkylate DNA in both dividing and resting cells, leading to cell death during the mitotic phase of cell division. Azathioprine and methotrexate block DNA synthesis, preferentially killing cells that are in the S phase or DNA synthesis phase of the cell cycle. The major use of these drugs has been to kill malignant cells. Cytotoxic agents, however, also suppress both humoral and cellular immunity. Because the B cells or T cells that are stimulated by antigen go through active proliferation, cytotoxic agents exert their killing action on these actively dividing cells. This may not be the only way that these drugs cause immunosuppression. Nonetheless, they are an important part of the immunosuppressive therapy given during organ transplantation. They have also been used with with some success in the treatment of various autoimmune diseases. These drugs, however, have numerous and serious side effects. The second immunosuppression scientists use is glucocorticoids. Glucocorticoids are potent immunosuppressive and anti-inflammatory agents. They are used regularly in treatment of graft rejection, allergies, and asthma. The immunosuppressive effect of glucocorticoids are poorly understood. They appear to reduce the levels of circulating lymphocytes and monocytes and suppress the production of interleukin 1 and 2. Glucocorticoids have a diversity of actions, and the clinical benefit seen in allergy and autoimmunity seems to be due to the various other actions of these drugs together with their immunosuppressive properties. The chronic use of glucocorticoids is associated with serious side effects that hamper their continued use in some patients. Cyclosporine and tacrolimus. Cyclosporine is a cyclic polypeptide containing 11 amino acids derived from soil fungi. Just after implantation of a foreign graft, foreign antigen-sensitive T cells begin to get activated. Cyclosporine acts selectively on antigen-sensitive T cells in the G0 to G1 phase and blocks the transcription of lymphokine mRNA, thereby suppressing interleukin 2 production. This effectively blocks T cells activation and proliferation. Resting T cells, which carry memory for immunity to infectious agents, are spared. It has also been shown that the drug leads to the development of active suppressor T cells, which could actively maintain tolerance to the grafted tissue. Cyclosporine has been used successfully to prevent graft rejection and in the treatment of graft versus host disease. It has little toxicity for dividing cells in the gut and bone marrow. Side effects of cyclosporine include nephrotoxicity and hepatotoxicity. It has also associated with an increase in B-cell lymphomas, though the incidence reported is relatively low. Tacrolimus is a macrolide antibiotic that works in a mechanism similar to that of cyclosporine to prevent allograft rejection. Anti-lymphocyte antibodies. Anti-lymphocyte globulins have been shown to deplete lymphocytes and produce immunosuppression. They prolong graft survival in reception though long-term effects have been variable. Monoclonal antibodies to the T-cell surface antigen CD3 and the interleukin 2 receptor have been used for treating host rejection of allografts. Both agents have been associated with several problems, including unpleasant side effects. Thank you.